Assalamualaikum warahmatullahi wabarakatuh. My name is Rizal Adnan Sudarman from Grade 11 Multimedia 1. I'm in here will presentation my project about COVID-19. COVID-19. Origin of variant coronavirus. As quoted from the World Health Organization or WHO, the coronavirus comes from coronaviruses or COV, which causes disease ranging from the common cold to more severe ones such as mild respiratory syndrome or MERS-CoV and severe respiratory syndrome or SARS-CoV. Meanwhile, novel coronavirus or nCoV is a new strain that has not been previously identified in humans. Coronavirus is genetic, meaning it is transmitted between animals and humans. According to investigations that have been carried out, SARS-CoV was transmitted from civet cats, or better known as civets, to humans, and MERS-CoV from camels to humans. However, some coronavirus are also known to circulate in animals that have never previously infected humans. Characteristic being infected with the coronavirus. Characteristic of people infected with the coronavirus will lo- virus with lower level as quoted from the CDC. When the people feel fever, cold, shortness of breath. Meanwhile, patients with higher level will experience symptoms of the coronavirus in the form of difficulty breathing or shortness of breath, pain in the chest, dizziness or inability to stand and move the body, lips or face look blue. If you feel the symptom of the coronavirus as mentioned above, especially patients with higher level, then immediately go to the doctor for medical treatment. Symptoms of coronavirus in humans from day to day. For more detail about what is meant by the coronavirus, here are the characteristics of the coronavirus in humans day by day, excluded from Business Insider Singapore, based on data from Zhongnan Hospital of Wuhan University. Day 1. The patient has symptoms of the coronavirus in the form of fever. Patient, patient may also experience fatigue, muscle aches, and a dry cough. A small percentage of these people may also have had diarrhea or nausea for the previous 1 to 2 days. Day 5. Patient experiencing symptoms of the coronavirus in the form of difficulty breathing, especially for for patients who are elderly or have a history of illness. Day 7. The patient experienced symptoms of the coronavirus in the form of worsening condition before the patient who is finally rushed to the hospital. Day 8. At this point, patient will suffer cases 15%, according to the Chinese CDC, will develop symptoms of the coronavirus in the form of acute respiratory distress, an illness that occurs when fluid collects in the lungs. Ours is often fatal. Day 10. If the patient has worsening symptoms, this is the time in the disease progressing when they are most likely to be admitted to the ICU. This patient may have more abdominal pain and loss of appetite than patients with milder cases. Only a small percentage die. The current death rate hovers around 2%. Day 17. The average person who has recovered from the symptoms of the coronavirus will be discharged from the hospital after 2.5 weeks. Those are some of the symptoms of the coronavirus in humans that you need to know. After knowing clearly what the coronavirus is and its symptoms, you also need to know how to prevent coronavirus infection. How to prevent coronavirus? The most important way to prevent infection with COVID-19 or coronavirus is to maintain health and hygiene. As quoted from the WHO, the basic recommendation to prevent the spread of infection are to wash hands regularly with soap, cover the mouth and nose when cooking or sneezing, and cook meat and eggs thoroughly. In addition, avoid direct contact with anyone showing symptoms of the coronavirus, such as shortness of breath, coughing, and sneezing. Here are some things you need to know about the coronavirus. Hopefully, by better understanding what the coronavirus is and knowing its some symptoms in humans and how to prevent it, we can all avoid the danger of spreading an infection with the coronavirus. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.